morning, everyone. All protocol observed. I'm going to be sharing my screen with you this morning. So my topic for today is diabetes. Some of us call it blood sugar, high blood sugar, low blood sugar. What is diabetes? So diabetes is a condition, is a disease that occurs when a person's body doesn't make enough of the hormone insulin or can't use insulin properly. There are two types of diabetes. There's type 1 and there's type 2. Let's talk about what happens in the body with your insulin. So there's an organ in your body called the pancreas. It's an organ near your stomach that contains a beta cell that releases a hormone that is called insulin. Insulin helps to move the glucose from your blood into your cells. Insulin is like a key. It unlocks the doors of your cells so that your glucose can get in and be used as a source of energy. Without insulin, extra glucose can't get into the cells, and it stays in your bloodstreams. The most common types of diabetes are type 1 and there's type 2. And type 1 and type 2 does not only occur in adults, it also occurs in children. Type 1 diabetes, the body makes little or no insulin due to the immune system response that destroys insulin-producing cells. So people with type 1 diabetes must take insulin every day. Type 1 diabetes usually occurs in children and young adults, but it can also appear in older adults. Then you have type 2 diabetes. Your body does not respond to it and use insulin as well as it should, or it may not make enough insulin. Most people with diabetes have type 2. Some risk factors for this kind of diabetes includes older age, being overweight or obese, a family history, and having certain ethnic backgrounds. So type 2 diabetes is actually treatable. We've had patients that are obese that have had bariatric surgeries and that have actually reversed that for them as well, just so you're aware. Here is our type 1. I just described to you what happens in the cell. So this is your normal, and this is your type 1. So if you notice in the difference in the type 1, the glucose accumulates in the blood and it cannot penetrate into the cells. In your normal cells, when it accumulates, it actually penetrates itself and come out. Type 2, that a lot of adults tend to have this. And I give you all the steps of how it is broken down with the food, your glucose, and it goes all the way around. My screen is acting up this morning. I'm so sorry. These are your risk factors when you have type 2 diabetes. Again, I went through some of them, but just to make it a little clearer, this includes also poor nutrition during pregnancy. What are some of the symptoms of diabetes? How do I know I may be diabetic? You may show these kind of symptoms. You may feel tired and sleepy. You may become confused because of your blood sugar level. You may pass out because of your blood sugar level if it's too low. You may have stomach pain, feeling sick, needing to go to the bathroom and pee a lot more often. And when they test your urine, you have what's called ketones. Sometimes you may actually smell it. You may have blurry vision. Your breath may have a sweet smell. And of course, when you check your blood sugar level, it is high. I've heard stories of people not knowing that they have it until when they're actually moving around and their vision just becomes completely blurred. And that sends them into high levels. Then there's what's called a pre-diabetic state. If some of you didn't, I've never heard that term before. So before you go into a type 2, there's always some symptoms to give you some warning signs that there's something that is not right. And the pre-diabetic state is when your blood sugar level is higher than normal, but not high enough yet for you to be diagnosed as a diabetic. So please make sure that you're listening to your body. When those symptoms start to happen, you want to make sure that you see your provider, follow up, and get yourself checked. Don't ignore symptoms and say, oh, I'm probably tired or probably ate too much. A lot of us like to do that. So please make sure that we are following up. The pre-diabetics risk factors and warning signs, it's basically the same unhealthy eating, eat a diet that is high in sugar, a lot of processed food, eat things that will increase their cholesterol level, excess weight, family history, advanced age, as well as smoking. These little ones, we don't like to hear that they have it, but unfortunately, you're never too young to have diabetes. Sometimes babies are born and they have diabetes. So it's important that you're aware of those symptoms that children will show, which is the same. If they are infants, newborns, as a parent or a caretaker, you just have to monitor them very, very closely. And usually the physicians are able to tell you that prior to you taking the baby home and during their follow-up visits. So it's important that you also make sure that they keep their follow-up visits. Now, children, as resilient as they are, they have a very hard time at times dealing with it, but they learn how to live with it. And the fact that some of them may have to have the devices attached to them, get their blood sugar checks, they may get tired and can't play as much as their friends. And so we want to make sure that they have the support that they need of not only their classmates. Sometimes it's good for their teachers to know that they have it. It's important that the school know if they are in school, because if something happens, they want to be able to know how to manage that there. You never want to keep something like that from your school teachers or the principal or the nurse that is in that setting, because children turn pretty quickly when their blood sugar drop or when it gets very, very high. Now, there's a symptom called hypoglycemia and hyperglycemia. So your symptoms are going to be different if your blood sugar is low versus when it is high. When you have a low blood sugar, that is called hypoglycemia. Okay, that person becomes shaky, they have a fast heart rate, they perspire a lot, they sweat a lot, they become very, very dizzy, they become very anxious, they're hungry, they want to eat just about any and everything. Their vision becomes blurry, they're very tired, they get headaches, they are irritable, and you have to treat it. And what do? You have to check it. They have to check it. Some people will know that it is low. Most diabetics, we encourage them to walk with something that will bring their sugar back up quickly. One of the things that I have advised some people is that even the icing that you put on a cake, there's a little tube for it, that you walk with it. Because if that person's blood sugar drops so low that they may pass out, you can actually put that on your finger and rub it on their gums, and it will get into their system. If you go into their mouth and just rub it in their gum, it gets into your system and absorbs quickly. The symptoms of hyperglycemia: increased thirst, hunger as well, fatigue. They go to the bathroom, they frequently urinate. And that's a big difference between the person that is hyper and the person that is hypo. The hyper person also loses a lot of weight. They may have a lot of skin infections that is not, and when you are diabetic, when you get a cut, it's very difficult for that cut to heal. Another sign that I wanted to talk about that a lot of people do not realize is that, especially in children, when they're showing the signs that they may be becoming diabetic, the armpits or the back of their neck is very dark compared to the rest of their body. Those two areas change color quickly. So you want to keep an eye on that as well. The future for continuous monitoring has changed. We've had so many devices out on how to check your blood sugar that I think now they have, with technology, we have now advanced to different devices, but the older ones still work as well. So you don't need to go and spend a lot of money to get the expensive ones, but I'm just letting you know that there are new devices as well. So I'm going to go through some of those. We have this one. It's a continuous monitoring that is placed in the person's arm, and they have a little device that they literally scan it over the arm and it reads their blood sugar. And it's also great when a person is actually sleeping. That is, sometimes some parents or whoever it is don't want you to be waking them up to stick their finger. That device is just used, and then it picks up the blood sugar level. And that's called a continuous glucose monitor. It can either be on the stomach, but lately we've been doing it on the arms. And it can detect and notify you if your glucose level is reaching a high or a low limit. It can actually alert you before you reach that glucose limit. So there's a lot of patients actually now, including children, that walks around with this particular device. Then our typical glucometer works just as well as that fancy one that I just showed you that may cost a little bit more money, but your insurance covers it. And this is the one that even when we do medical missions, we tend to travel with a lot of these because especially coming into Jamaica, we realize there's a lot of diabetics that are walking around and not even knowing that they are diabetics. In the United States alone, we have about a total of 23.6 million people that have diabetes. And that's only the US alone. So I can't imagine if I should count the other countries, how many diabetics I would find. These are all the devices that we now have out, a couple of them. And the prices range from $1,339 going all the way down to about $80. So they can be very, very pricey. Where can you find information? Should you need any information on diabetes, you can go to the NIH.gov. You can go to diabeteseducator.org. You can also go to diabetes.org or jdrf.org. Next Sunday, because of time constraint, and I want to be mindful of that, I'm going to be discussing the complications of diabetes and nutrition. Yes, there's certain things that you should be eating and should not be eating. I'm also going to show you how to calculate your carbohydrates in your food. Tips for when you're eating, if you're away from home. So if you go on vacation, it doesn't limit you from eating. You can have food, but we're going to talk about the things that you should be mindful of and understanding what your blood sugar level is and what it should be. The acknowledgements for today are these companies, including Medline, WiredGov, National Institute, Drug Watch, Libiotech, and Endocrine Web. If there's anything, any questions that you may have and that I did not cover in my summary, I'm going to ask that you join us in the Zoom room after service has ended on Facebook, and you can ask me as many questions as you would like. And if information that I don't know, I will get back to you. But thank you for your time. Thank you for your patience. I hope you have been blessed by the service so far, and I know that you'll be blessed. Just stay on for the word. That's always a good word every Sunday. At this time, I'm going to hand back over to our moderators. Thank you so much.